Thank you. Welcome back. Let me thank the Executive President, Dr. Brodstorm, for his excellent chairing and moderation of this discussion. I would like to call on him again for chairing the discussion on the next item. But allow me first to introduce agenda item 4, the European Programme of Work 2020-2025, United Action for Better Health in Europe. The relevant documents for this item are EUR/RC70/11, Ref 4. The related draft resolution and its cousin can be found in respectively documents EUR/RC70/confdoc/5, Ref 4, and EUR/RC70/11/Ref 4 add 1, EUR/RC70/infdoc/5. This agenda item requires our full attention as the European Programme of Work sets out the priorities for the WHO Regional Office for Europe for the next 5 years, which has become even more relevant and critical in the current context of the pandemic and the role of WHO in the response. Let me point out that the EPW has gone through an extensive consultation process under the guidance of the Standing Committee of the Regional Committee. Next to the member states of the European region, it has also been shared with the presented to a range of partners, including the European Commission, intergovernmental and UN organizations, non-state actors, as well as WHO staff. I'm sure you will all have read carefully the final iteration that is now submitted for endorsement to the Regional Committee. I look forward to a lovely discussion, but before that, I would first like to invite the Regional Director to introduce this topic and to present his vision and plans for the future. Dr. Kluge, you have the floor.
Thank you very much, Mr. President. Excellencies, ladies and gentlemen, I now would like to submit the European Programme of Work, United Action for Better Health to you. If approved, it will orient and transform the work of the WHO Regional Office for Europe between now and where originally the EPW was to be submitted to the Regional Committee next year, but the Standing Committee of the Regional Committee in November 2019 asked the Secretariat to prepone the submission and submit it to the Regional Committee 70 this year. This was in order to align with the GPW, but even more so, to build upon the vision that accompanied the discussions which emerged during my appointment as a regional director. These discussions happened in a free, frank, and friendly atmosphere, which really caused that we could have discussions rethinking how to work together in an innovative way. The member states expressed a clear wish, number one, for stronger unity and solidarity for better health in the region. Number two, for more investment in national health leadership. And third, to tackle the inequalities within and between countries by leaving no one behind. Then, building upon those political imperatives, we started to draft the overarching priorities from the basis: what do the citizens reasonably and legitimately expect from their health authorities? The citizens, the people, expect the right to be guaranteed to universal health coverage. Number two, to be protected from health emergencies. And number three, to be able to thrive in healthy communities where public health actions and public policy enable healthier lives towards an economy of well-being. But then, as we accelerated the development of the EPW, the COVID-19 came in. And this necessitated to rethink the place of health in the European society. But in fact, what happened is that instead of slowing down, the COVID-19 outbreak accelerated the development of the EPW. First and foremost, it necessitated to rethink what do the people expect legitimately from their health authorities in a COVID-19 context, which led to the 3 priorities and the 4 flagships: mental health coalition, digital health and innovation, behavioral insights, and the immunization 2030 agenda, which, if approved, can boost political commitment and give a much higher visibility to the health sector. And secondly, the COVID-19 refocused our minds on the how to work better together. And first how is focus on the country impact. The second how is to reorganize the WHO Regional Office for Europe in line with the overarching priorities and the 4 flagships. And the third how, critically, is to work differently with the partners, using our influence to ensure that all member states have a voice at the multiple international fora where health is at the political agenda, and using our leverage to rally partner organizations behind agreed priorities, building synergies. Despite of the short time frame, as Dr. Tsoi, our president of the Region Committee, was telling, we did follow a consultative process with the Standing Committee of the Region Committee first, then with all 53 member states, a very productive session with the European Commission, the Central Eastern Initiative, the staff, the United Nations agencies, and also special session with the non-state actors, the civil society. That's why I feel that across the European health landscape, there is a strong sense of ownership of the EPW. And therefore, I'm submitting to you the European Programme of Work 2020-2025 for your approval and endorsement. Thank you.
Thank you, Regional Director, for this clear overview of the European Programme of Work. I'm sure this will generate a lovely and interesting discussion to speak to the importance of mental health that was highlighted by the Dr. Kluge. It is my great honor to now introduce Her Majesty Queen Mathilde of the Belgians, who is an eminent SDG advocate appointed by the United Nations Secretary General with a particular focus on mental health. We will now see a short video statement from Her Majesty, who will be a champion of the Mental Health Coalition that is proposed as one of the 4 EPW flagship initiatives.
Okay, I think we have a technical problem, unfortunately, with the statement by Her Majesty Queen Matilda of Belgium. Dr. Tsoi, do you want to take over chairing, please?
Thank you. Let me now introduce another important guest speaker on this agenda item. We will now hear from the EU Commissioner for Health and Food Safety, Ms. Stella Kyriakidis, who will also address the regional committee through a video statement. Please.
So,
We are ready for video.
So, Mr. President, Dr. Tsoi, it seems... here we go. Now it works.
Monsieur le directeur régional, Excellences, Mesdames et Messieurs, une bonne santé mentale nous aide tous à réaliser pleinement notre potentiel. Elle renforce notre résilience et notre capacité à gérer les changements et les incertitudes. Il est essentiel d'investir dans la santé mentale pour permettre aux sociétés de prospérer. En tant que défenseur des objectifs de développement durable, j'ai décidé de faire de la santé mentale l'une de mes priorités. La pandémie du Covid-19 est venue nous rappeler combien la santé mentale est essentielle pour le bien-être de chaque personne. Cette crise a déjà eu un impact psychologique considérable. Elle a révélé les limites de nos systèmes de soins de santé en général et de santé mentale en particulier. Il est aussi extrêmement inquiétant de constater que des facteurs qui fragilisent la santé mentale, comme l'isolement, le chômage, l'endettement, la pauvreté et les inégalités sociales, augmentent rapidement dans le monde. Il faut craindre en conséquence une hausse des cas d'anxiété, de dépression et de décès par désespoir, surtout parmi les plus vulnérables. Mais cette crise peut aussi servir de catalyseur pour améliorer les services et pour changer le regard de la société sur la santé mentale. De nouvelles initiatives émergent, notamment en matière de sensibilisation. Pour réaliser ces changements, il faut des responsables déterminés et des partenariats solides. Il est encourageant de voir la santé mentale prendre une place centrale dans le nouveau programme de travail de l'OMS Europe. Je suis heureuse de constater, en tant que défenseur des objectifs de développement durable, qu'une nouvelle coalition de partenaires pour la santé mentale prend forme au sein de l'OMS Europe. Nous pouvons et nous devons faire mieux, non seulement en protégeant et en soutenant les personnes confrontées à des problèmes de santé mentale, mais aussi en promouvant le bien-être mental. Ce sont des éléments essentiels de la couverture de santé universelle, de l'équité sociale et du développement durable. Engageons-nous ensemble à agir pour une meilleure santé mentale à l'avenir.
We are very grateful for this inspiring contribution by Her Majesty, Queen Matilda of the Belgians, advocating for an increased attention to mental well-being of the people. Shall we now also hear from the EU Commissioner for Health and Food Safety, Ms. Stella Kyriakides, the address to the Regional Committee through a video statement.
Dear Dr. Tedros, dear Dr. Kluge, dear Hans, dear ministers, delegates, the past months have shown more than ever how important global responsibility and solidarity are, how indispensable both are in order to manage the biggest public health crisis humanity has faced in 100 years. It is only through multilateralism that we can bring about global solutions to problems that touch each and every one of us. The cooperation between the EU and the WHO is a cornerstone of this framework. Two organizations that have both shown global leadership in the spirit of solidarity in their every action since the onset of the pandemic. I want to begin by thanking WHO Europe, and especially Hans, for the excellent collaboration over the past few months. The WHO plays a key leadership role at both global and European level, and I want to use this opportunity to express the European Commission's support for the valuable work you do. I welcome WHO's European Work Programme presented today for the period 2020 to 2025, which complements well the Commission's work and provides an excellent framework to improve health in our region. The themes of the 4 flagship initiatives, immunization, digital health, mental health, behavioral insights, will enable us to build on the lessons learned from the pandemic and support Europe's recovery. These initiatives offer good opportunities for synergies in common priority areas. I take a very topical example, vaccination. We need to join forces, whether it is in utilizing and promoting existing vaccines, fighting disinformation and vaccine hesitancy, or our efforts to develop a vaccine to fight the coronavirus globally. This is the only way we can make a difference. Digital health is a priority of the Commission, and I welcome the synergies in the European Programme of Work. The COVID-19 pandemic has shown how important digital solutions are and has in some aspects accelerated the digital health agenda. The challenge of mental health is very close to my heart. As a mental health professional, I have witnessed firsthand the impact on families and patients affected. The COVID-19 pandemic has made our citizens even more vulnerable to stress, anxiety, and psychological suffering. We need to do more to become the voices for those who have no voice themselves. We are staunch supporters of a health in all policies approach. If we want to tackle antimicrobial resistance, chronic disease, and address the impact of cancer, we need to look at health holistically. The EU has shown and will continue to show its unwavering commitment and global leadership in these unprecedented times. We have authorized treatments, coordinated clinical trials, issued public health guidelines with ECDC in close cooperation with the WHO, and facilitated the supply of personal protective equipment for our frontline healthcare workers. For the benefit of citizens globally, we have committed €400 million to the COVAX facility in order to ensure vaccines for middle and low-income countries. We hosted the Coronavirus Global Response Pledging Initiative, which has raised €16 billion to develop and deploy therapeutics, diagnostics, and vaccines. We have stood next to the WHO at every step of the way, and we will continue to do so. Ladies and gentlemen, today, our future cooperation is placed on even stronger foundations. I hope that I can be with you in person at next year's Regional Committee and look forward to the day that together we can eliminate COVID-19 and tackle the long-term health challenges of our region. Thank you, and I wish you every success in your deliberations.
We thank the EU Commissioner Kyriakides for this engaging statement. Before we move into the discussion, let me see if Regional Director Hans Kluge want to add anything to the partnership between WHO Europe and the European Commission. Regional Director, the floor.
Thank you, Mr. President. First and foremost, I must say that I'm very humbled by the intervention made by Her Majesty the Queen Mathilde of the Belgians and her call for our action on promoting mental well-being. It's very important, and I am immensely grateful to Her Majesty to support the very important Mental Health Coalition, which is a flagship in the draft EPW. I would also like to thank the EU Commissioner Kyriakides for her message just now and really congratulate her for her effective leadership during the COVID-19 crisis. In this time of the crisis, the European Commission has been a strong advocate for solidarity and collaboration and a key partner in our joint efforts against the pandemic in the region. Together, we provided critical assistance and medical supplies to countries and people in need during the COVID-19, and we are working together with other partners on making vaccines available for all from a pan-European perspective. As the Commissioner Kyriakides stressed, today our future cooperation is placed on even a stronger foundation. I am indeed very pleased to inform you that the Commission and WHO Europe have endorsed a joint statement that calls for a deeper and result-oriented partnership between our organizations. Now more than ever, partnership is a matter of ethical duty, not just of goodwill. And it is only by working together that we can defeat COVID-19, protect the region against other threats and improve health for all. Today, with the Commission, we walk the talk. Thank you very much.
Regional Director, thank you. This announcement of the deeper partnership between the European Commission and the WHO Europe to improve health across the region and actively support countries in achieving better health for all is an important development for the region. The text of the statement will be posted and made available to you now on the WHO website. Let me now pass back the floor to Copenhagen, to the Executive President, to open the floor for the discussion.
Thank you very much, Mr. President, Dr. Toy. I will now open the floor for discussion on agenda item 4, and I will follow the same approach as in the previous discussion round. And again, I would also encourage all in delegations to observe the time restrictions and keep your intervention short and concise within the time limits. First, I will invite delegations who have pre-requested to intervene prior to our session today to take the floor. I also invite other delegations who have not yet requested the floor on this pre-established speakers list, but who are wishing to speak, to indicate so in the Zoom platform during the interventions. And the first speaker will be Germany on behalf of the EU, to be followed by Armenia. So the delegate of Germany, you have the floor.
Yes. Mr. President, Mr. Executive President, colleagues, I hope you can hear me. And let me first of all very much appreciate the excellent presentation just given by the regional director. On that basis, it's a real honor for me to speak on behalf of the European Union and its member states. And I understood that the candidate countries, Montenegro, Albania, as well as Ukraine, Armenia, North Macedonia, Moldavia align themselves with this statement. The European Union and its member states welcome the European Programme of Work and thank the regional director for the broad consultation. We appreciate the weight given to COVID-19 pandemic response and to increasing our regional preparedness for future cross-border events. We comment the alignment of the European Programme of Work with the three pillars of the 13th Global Programme of Work, the commitment to the achievement of the SDGs and the need to continue addressing determinants of health and health inequalities in order to leave no one behind. The European Programme of Work rightly observes the pandemic has had an impact on all parts of our societies, and thus it has put in a really unprecedented way health at the center of public debate. This provides a unique momentum to advocate for investment in health and well-being across sectors and, of course, beyond the present emergency. Countries will need a solid rationale now to do so. Strong health systems with an adequate workforce are now in the middle of the pandemic, more than ever before, needed in the protection and promotion of health of our citizens. Member states will in the coming months and years come to the regional office with questions on what, how, and in which order they should do to strengthen their health system and essential health functions, including the capacity to detect and prevent health emergencies and respond to them. Commitments to universal health coverage, ensuring patient-centered health services, and guaranteeing continuity of essential health services, in particular vaccinations and mental health, with special emphasis to the needs of the most vulnerable, continues to be essential while ensuring social protection from catastrophic health expenditure. The European Programme of Work recognizes the health services in communities are provided also by other actors, including by social services. As these services are in many countries governed by other sectors than health, a strong legal framework is essential to ensure the quality and integration of health services. The world, let me stress that, is increasingly interdependent. We therefore give our strong support to the emphasis of the European Programme of Work on increased collaboration with relevant European actors and on strengthening the voice of the health sector in Europe. The European Union and its member states welcome the programmatic nature of the European Programme of Work instead of a list of activities and the choice of flagship priorities and the inclusion of AMR and patient safety and the importance given to sexual and reproductive health and rights in accordance with the 2017 EU Consensus for Development. The alignment with the GPW reporting will prevent any increase of reporting burden for member states. At the same time, we know that the new approach will influence the way governing bodies will have to assess the performance of the regional office, which requires further discussion. Mr. President, Mr. Executive President, the 53 member states of the WHO Regional European Region have now a one-time opportunity to strengthen multi-sectorality and a whole-of-society approach for health. Let us do so by promoting the recognition of health as a key driver for economic recovery, societal resilience, and environmental sustainability. The European Union and its member states will continue the constructive collaboration with and the support to the regional office. Thank you.
Thank you very much. I now give the floor to the delegate from Armenia, to be followed by Slovenia. Armenia, you have the floor. It seems like we might have a technical problem. Should we move on to the intervention from Slovenia? So let's see if we can get Slovenia on.
Distinguished President, Director General and Regional Director, dear delegates. Slovenia would like to align itself with the statement of the EU and its member states. In looking for appropriate solutions to response to the COVID-19 crisis, the WHO and in particular the European Office has been of enormous help with its advice and good practice sharing. We appreciate that we were all invited to contribute with the experiences gained on the spot while dealing with the epidemic. The epidemic has affected all the regions of the WHO, and we have generated a substantial wealth of knowledge in a very short time, useful for all countries alike. In the next phase of COVID-19 crisis, we would focusing on regional specifics of response and working together to develop more tailored solutions as an appropriate direction. While strengthening our preparedness, we still need to reconsider the consequences of the crisis that will, no doubt, challenge the sustainability of most of our health systems. Slovenia is thus looking forward to the adoption of the European Programme of Work and its implementation in 3 core priority areas under the slogan United Action for Better Health in Europe. Strengthening primary health care and developing strategic solutions in this regard is considered by Slovenia as appropriate direction. Based on good experiences in mental health and primary health care, we expect organization also in the future to support member states with country-tailored assessments of different health system functions. We strongly believe in working together to develop innovative solutions, and we recognize many opportunities in doing so under the umbrella of the WHO. Thank you.
Thank you very much. Let's see if we can switch to Armenia. Let's see if we can get Armenia on. Otherwise, we will move on to Azerbaijan. If Armenia is not available, we will move on to the delegate of Azerbaijan. So, delegate from Azerbaijan, you have the floor.
Thank you very much for giving us the floor. Azerbaijan is fully supporting European Programme of Work 2020-2025, the United Actions for Better Health in European region, and we support fully the statement of the regional director, and we thank the regional director, Dr. Hans Krieger. Thank you very much. I really appreciate it.
Thank you very much, Azerbaijan. I think we will move on. So the next speaker is the delegate from Hungary, to be followed by Russian Federation. So Hungary, you have the floor.
Dear Regional Director, Chair, Honorable Ministers, distinguished delegates, the Hungarian government generally supports the commitment and core priorities set out in the working programme named United Action for Better Health in Europe. The document, in our reading, clearly emphasizes the current challenges posed by the COVID-19 pandemic, namely how to find the best way to provide emergency response with dedicated efforts and to maintain continuity of care. In Hungary, in the first wave of the pandemic, several new approaches were successfully tested and launched to ensure continuity of care, especially in the field of digital health. In fact, we could well capitalize those developments that have been systematically launched over the past years, including an integrated digital health technical platform. This technical approach offers various utilization possibilities for all the relevant stakeholders, including access to full history of patient diagnosis, the treatment, and making possible e-prescription and e-referrals. The regulation on digital health was approved by the government. There were emergency regulation in place as well, and that ensured a safe communication during diagnostic activities and the transmission of digital health records. Meanwhile, to scale up digital health services, it has become our health policy priorities. The Hungarian government is ready to facilitate and lead a more intense collaboration in elaborating the perspective of digital, innovative, outcome-driven and people-centered care. The pandemic highlighted again the importance of a well-organized primary and emergency care. Our aim is to strengthen primary health care throughout extending preventive and improving curative functions, and also to promote integrated healthcare services. The government would like to create a more resilient health system by implementing further interventions, for example, by scaling up previous programs. In addition to this integrated patient pathway to address the collaboration between the different layers of the care holders and the care providers, and as well between the chronic and home care, will be also applied. Having said this, however, we must express our reservation concerning the SRHR language used in the EPW. The term of sexual and reproductive health and rights and related issues like sexual rights are interpreted and promoted by Hungary in the context of the 2030 Agenda for Sustainable Development, the ICPD Programme for Action, and the Beijing Declaration and Platform for Action, in line with the relevant national legislations. For these reasons, I inform you that Hungary considers the points dealing with SRHR in the European Programme of Work as unsatisfactory. We wish to disassociate from that approach and the SRHR language. We ask, therefore, the Secretariat to reflect our declaration in the report of the committee meeting. Thank you very much for your attention.
Thank you very much, Hungary, and that is noted. I now give the floor to the delegate of the Russian Federation, to be followed by Armenia. Russian Federation, you have the floor.
Уважаемый господин председатель, уважаемый региональный директор, уважаемые коллеги, приветствуем Европейскую программу работы на 2020-2025 годы. Совместные действия для улучшения здоровья жителей Европы, подготовленную с привлечением широкого круга участников. Отмечаем комплексный характер программы, которая призвана дополнить 13-ю общую программу работы ВОЗ на 2019-2020 годы и оказать поддержку странам в выполнении принятых обязательств в рамках повестки дня в области устойчивого развития на период до 2030 года. Программа тесно коррелирует с целями и задачами стратегии развития здравоохранения в Российской Федерации на период до 2025 года. Отмечаем, что одним из приоритетов программы является защита здоровья населения в условиях чрезвычайной ситуации, таких как пандемия новой коронавирусной инфекции. Кризис, обусловленный COVID-19, заострил внимание на необходимости обеспечения готовности и быстрого реагирования на пандемию, а также на необходимости создания четких механизмов и структур управления и контроля в целях реагирования на чрезвычайные ситуации. Ожидаем дальнейшего усиления работы Европейского регионального бюро по данному направлению. Российская Федерация готова оказать Всемирной организации здравоохранения всестороннюю поддержку. Благодарю за внимание.
Thank you very much, Russian Federation. I now give the floor to the delegate from Armenia, to be followed by Poland. Armenia, you have the floor.
Honorable President, Director General, Regional Director, Ministers, Excellencies, distinguished delegates. It is my honor and pleasure to be part of this virtual session of the WHO Regional Committee for Europe. Although in these difficult times when the novel coronavirus pandemic has changed our agenda and lives and pushed many of us into new realities, one thing is clear for now. The priorities have not been changed, but even became bolder. The COVID-19 outbreak not only became a new challenge needed to deal with and revealed the gaps in our systems, but also showed our strengths developed on the valuable experience of responding to health threats. Pandemics of this magnitude do not respect borders. Therefore, they require global action to counter and overcome the crisis. Indeed, the national unity, regional cooperation and global solidarity are essential to these efforts. The epidemic one more time proved that health is one of primary concerns of all governments, and all of our efforts should therefore be aimed at strengthening the healthcare system, public health protection and ensuring sustainable development. Armenia attaches great importance to development and approval of European Programme of Work as a strategic landmark for joint cooperation between countries. We reiterate our high compliance to work closely with the WHO Regional Office for Europe and partner countries aimed at advancement of the health agenda. Undoubtedly, ensuring a good quality of healthcare and medical services is considered to be an integral component in up-to-date models of better health for all. We also reaffirm our strong commitments on strengthening prevention of diseases through early diagnosis and treatment as one of our priorities within the Sustainable Development Agenda. The primary care is the first point of contact with health services and provides a point of entry for the entire health system. Armenia continues improving access to primary and preventive healthcare services, with a focus on poor and vulnerable populations and regions that have received less attention in the past. The strengthening of primary and preventive healthcare services provision, the extension of basic benefit package for the poor and vulnerable, and financial protections are amongst the high priorities for us. This is in keeping with this logic that the Ministry of Health of Armenia is taking measures to implement the universal health coverage model, aiming at improving accessibility and affordability to medical services provided for the population. As a good example of universal health coverage is primary care system in Armenia, which is accessible for the total population with no charge at all. Excellencies, while we have a long way to go, I believe that working together with full commitment will bring its best outcomes in ensuring sustainable and significant improvements in our countries and worldwide. I am confident that a continuous, comprehensive, coordinated, community-oriented, people-centered, safe, timely, effective and efficient health system is a cornerstone on the way to achieve universal health coverage and seems to be a gold pathway to reach the Sustainable Development Goals and the better health for all. Let's make our solid steps towards our healthier tomorrow together. Thank you for your attention. Stay strong and safe.
Thank you very much. I now give the floor to the delegate of Poland, to be followed by Tajikistan. Poland, you have the floor.
Thank you, Mr. President. Mr. President, the Regional Director, colleagues, Poland aligns itself with the EU statement on the strategic elements of EPW delivered by Germany on behalf of the EU and its member states. The world is facing a huge challenge that we must respond to in a spirit of solidarity and cooperation. Only mutual understanding of our positions with transparent negotiation process of documents can guarantee proper exchange of views and build trust. We would like to recognize the leadership of Regional Director Dr. Hans Kluge in these challenging times and efforts made to restructure the Secretariat of WHO Euro, along with creation of the vision of our region for the next 5 years. Firstly, in the intensified fight against COVID-19 pandemic, we must ensure that other areas of health are not being left behind. COVID-19 pandemic has proved to be a huge challenge, not only as a communicable disease, but also having an enormous impact on our mental health. In the days of lockdown and constant fear, our mental well-being was severely challenged. Fighting so-called infodemic has been equally important as fighting the virus. In this context, we welcome establishing of the Mental Health Coalition. Secondly, Poland is constantly introducing new solutions and reforming mechanisms to raise the standards of living in a good health for our citizens. Since January the 8th, e-prescriptions are mandatory within the Polish healthcare system, and over 300 million e-prescriptions have already been issued. The COVID-19 revealed an urgent need for fostering implementation of effective digital tools, and the pandemic lockdown proved that our telemedicine solutions worked properly. Therefore, we are very committed to and strongly support the flagship initiative 2. Thirdly, we believe that the EPW, as a document that sets out strategic directions for the next 5 years, will serve as a basis for optimization of country offices and creation of country response teams to enhance the effectiveness of the whole organization. Finally, Mr. Chair, Poland would like to underline that the term related to sexual and reproductive health and rights used in the EPW is not in line with the language applied in the SDG 5.6 and the GPW 13, which for us remain the reference documents for commitments in this area. In the spirit of compromise, we do not want to block the consensus on the content of the EPW as a whole. However, we strongly urge the Secretariat to be consistent with the SDG language and GPW 13 when referring to this sensitive issue, so that the documents adopted by the RC are truly inclusive and not excluding. We kindly request to note the above position and the appeal to Secretariat in the official record from this session. Thank you for your attention.
Thank you very much, Poland, and your comments have been noted for the records. I now give the floor to the delegate from Tajikistan, to be followed by Austria. Tajikistan, you have the floor.
Уважаемый господин председатель, уважаемый господин региональный директор доктор Ханс Клюге, уважаемые участники 70-й сессии Европейского регионального комитета Европейского бюро ВОЗ. Республика Таджикистан поддерживает принятие резолюции Европейской программы работы на 2020-2025 годы, совместные действия для улучшения здоровья жителей Европы и утверждение ЕПР в качестве стратегического курса для дальнейшей работы Европейского регионального бюро ВОЗ. Успешное внедрение данной программы может быть достигнуто только при полной поддержке всех стран, участниц, партнеров, доноров и гражданского сообщества. Пандемия COVID-19 показала нам, как важно быть единым целым перед опасностью глобального уровня, которая не признает никаких территориальных границ и национальностей. Только общими усилиями мы можем достичь позитивных результатов и победить опасность. Европейская программа работ даст нам возможность еще эффективнее объединяться в общих усилиях, направленных на достижение цели 3 миллиардов. Всеобщий охват услугами здравоохранения невозможно без крепких и жизнестойких систем здравоохранения, обеспечивающих доступ хорошо структурированной первичной медико-санитарной помощи для каждого человека и способных эффективно реагировать на чрезвычайные ситуации. Обеспечение здоровой жизни и благополучия для всех людей в любом возрасте – это основная цель для всех нас, как ответственных структур здравоохранения, и мы должны приложить все усилия, чтобы привлечь как можно больше политического внимания на всех политических уровнях. Мы также хотели бы подчеркнуть важных новых флагманских инициатив, в особенности инициатив в области цифрового здравоохранения и инноваций, а также создание общеевропейской академии трансформационного лидерства ВОЗ для достижения нашей общей цели справедливости в отношении здоровья всего населения. Это будет долгий и упорный труд, так как имеется отсутствие надлежащего потенциала общественного здравоохранения. Нам необходимо будет укреплять нашу систему здравоохранения путем создания механизмов управления и увеличения численности квалифицированных специалистов и укрепления первичной медико-санитарной помощи. Мы должны будем обеспечить доступ к лекарствам и усилить финансирование сектора здравоохранения. Все эти задачи являются для нас первоочередными и являются частью нашей общей ежедневной работы, и мы выносим их на самый высокий политический уровень. При поддержке руководства страны Таджикистана готовится к переходу на электронный формат данных здравоохранения. Это будет поворотным моментом в развитии здравоохранения нашей страны с доступом к высококачественным и современным информационным данным. Мы, как страна-участник ВОС, привержены воплощению в жизнь глобального перспективного видения, сформулированного в ЕПР. Нам очень близки слова уважаемого генерального директора ВОС доктора Тедроса о том, что здоровье – это одно из прав человека. Никто не должен болеть или умирать лишь по причине собственной бедности или невозможности пользоваться необходимыми медико-санитарными услугами. Каждый из нас может сделать свой вклад на своем уровне, приложить максимальные усилия для достижения этого права на здоровье. Спасибо за внимание. Будьте здоровы.
Thank you very much, Tajikistan. And I'll give the floor to the delegate from Austria, to be followed by Croatia. Austria, you have the floor.
Thank you, Chair. Austria aligns itself with the statement of the European Union and its member states. Thanks also for the comprehensive involvement of all stakeholders in the development of this document. The European Work Programme 20 to 25, Together for Europe, is convincing in its strategic orientation, and it is fully supported in its three priorities on the four flagship initiatives. The COVID-19 crisis is not over yet, and we will have to live with the COVID-19 even longer. Leaving no one behind, equal opportunities in access to universal health care and addressing health inequalities are therefore key issues in our region. In addition, leaving no one behind means also protecting sexual and reproductive health and rights. We would like to emphasize in particular the importance of mental health care, the change in the participation of service recipients, and the importance of cooperation of health systems with other policy areas such as social policy and urban planning, as well as the importance of prevention. The pandemic shows that a sustainable health policy requires increased cooperation between all policy areas involving all social actors. Almost every policy area has an impact on health, and therefore a steering mechanism is needed to implement the health in all policy approach. The pandemic also has shown how important it is to ensure that health communication is comprehensible for the individual citizen and to focus on healthy literacy. We therefore hope that the WHO Secretariat will strengthen this aspect. A sustainable health system for the citizens also needs a strong stakeholder perspective or involvement in planning and development processes on health issues. This is especially important when it comes to maintaining public confidence in healthcare. Just think about the many conspiracy theories surrounding COVID-19 and the potential of an effective vaccine. We welcome the fact that the European Work Programme is not an exhaustive exhaustive inventory of WHO Europe normative and technical tasks, but is operated as an open process that can respond to global and regional development. Thank you very much, and congratulations to this wonderful work programme.
Thank you very much, Austria. And I'll give the floor to the delegate from Croatia, to be followed by San Marino. Croatia, you have the floor.
Thank you. Dear Director General Dr. Tedros, Regional Director Dr. Kluge, dear colleagues, Croatia aligns with the statement of the EU and its member states. These are special times, and this is indeed a unique session of the Regional Committee. First, Croatia would like to thank the Regional Director for his leadership, his team, and all WHO staff for their active role in supporting our region during the COVID-19 pandemic. We would also like to thank and recognize everyone throughout the region whose extreme efforts in fighting this pandemic remain essential, especially those of healthcare workers in the front lines. Our sympathies go with the families of all affected. We welcome the European Work Programme and its role to support WHO 13 General Work Programme. We are already faced with the new complex challenges where country and region tailored support is needed. One of the important challenges in our region is reducing health inequities within and between member states, having in mind that health is influenced by factors outside the health system. For healthy and happy citizens, healthy workforce, healthy future for our children, a strong health systems, and whole of government approach, health in all policies, one health approach are needed. Today, unlike in the past, health sector does not need to stress its importance and fight for the place in the spotlight anymore. This pandemic has indeed emphasized the importance of the hard work being done in the health sector. And today, health is in the center of our everyday life. We welcome the following our 4 flagship initiatives: the European Immunization Agenda 2030, healthier behaviors, incorporating behavioral and cultural insights, the Mental Health Coalition, and empowerment through digital health. All are important now and will be in the future. We would also like to highlight that people-centered health and the social services, equitable access to future COVID-19 vaccine, people's behavior, and healthy actions for life, investment in the mental health should be considered as priority areas for further work. We have to unite our efforts, work together with our partners, leave no one behind, and move forward with lessons learned in the challenging time. For that, we need a vision, a work program, strong leadership, excellent mutual communication and cooperation, and strong regional office and strong WHO. Thank you for your attention.
Thank you very much, Croatia. I now give the floor to the delegate of San Marino, to be followed by Estonia. San Marino, you have the floor.
Thank you. Thank you very much, dear Director General, dear Regional Director, Excellencies. The Republic of San Marino is a small country. However, this is one thing that makes it stand out among all other countries, namely its long-lasting democracy throughout history. There is no secret for an enduring democracy. If citizens come first, their voice is heard. If they are actively engaged in a constructive manner in political life, if policies of all kinds are people-centered, democracy will last. Because ultimately, citizens themselves govern the country through us who serve them. Among all values, objectives, and core priorities included in the forward-looking European Programme of Work, United Action for Mental Health, which embeds the vision of our regional director, Dr. Hans Kluge, I was impressed by one element when I read it. In setting priorities for the coming 5 years, we start from what citizens in the region legitimately expect from their health authorities, citizens and health authorities. It is a continuous constructive dialogue where health objectives are not chosen by technocrats from above. Citizens must be empowered. We need to hear from them how the 3 priorities set out on EPW make them feel protected, cared for, and help them enjoy a better quality of life. There is another element in the EPW that particularly reflects the principles of the Republic of San Marino. It is right in the title of the EPW, United Action for Better Health. Dr. Kluge could not have proposed a more suitable title for small countries. It was with this very concept that in 2012, the Republic of San Marino signed an agreement with WHO and the WHO Venice office to fund and co-lead the Small Countries Initiative. This was a winning idea, immediately praised by the former UN Secretary General Ban Ki-moon in his speech in San Marino in 2013. More recently, it was taken as a model by the WHO Director General, Dr. Ghebreyesus, during his visit in April 2019. We can be small in size in our population, we can be islands or landlocked countries. There are many characteristics that differentiate us from larger countries. However, there are many more characteristics that make us similar among ourselves. An example thereof comes from our recent experience with COVID-19. Our hospital in San Marino did not have any infectious diseases wards. In a few days, the entire facility was converted into a COVID-19 hospital to cope with the dramatic increase in the number of cases. This is an example of how flexible small countries can be. The Republic of San Marino is committed to continuing its support to finance and co-lead the Small Countries Initiative with one mandate: to promote the initiative as the main platform to guide the implementation of the EPW in small countries. We aim to do this by aligning our policies with the EPW, sharing EPW implementation practices, strengthening technical capacity in the EPW, and involving the media as strategic partners for the enforcement in WHO policies. The Republic of San Marino fully supports the EPW, together united for small countries. Thank you.
Thank you very much, San Marino. Next, I give the floor to Estonia, to be followed by Turkey.
Honorable Regional Director, Excellencies, distinguished colleagues. Estonia aligns itself with the statements made by Germany on behalf of the European Union and its member states. I would like to thank the Regional Director for his personal dedication in keeping close contact with countries in the region and the European Regional Office for their work during these difficult times. Thank you, Hans, for the openness and close collaboration. We welcome the Regional Director's report and fully subscribe to the three fundamental lessons learned from the COVID-19 pandemic: need for solidarity, stronger health systems, and interconnectedness of health and economy. We acknowledge WHO's agile and timely response to the pandemic and the immense effort to provide technical and normative assistance to the countries, especially those most vulnerable. The implementation of the international health regulations needs a critical review by recognizing that member states are responsible for ensuring their national core capacities. While fighting the pandemic, we also need to keep a broader perspective globally, regionally, and nationally, not to lose sight of the Sustainable Development Goals. We welcome the Pan-European Commission on Health and Sustainable Development led by Professor Monti and look forward to its report. To avoid long-term negative health effects, it is necessary to maintain a strong focus on mental health and prevention of major chronic diseases, addressing the main risk factors, such as alcohol and tobacco consumption, physical inactivity, and unhealthy diets. Emerging trends such as novel tobacco products challenge our public health efforts and require common response. The importance of strengthening the health systems and primary care, as well as ensuring equal access to affordable medicines, has been once more underlined by the ongoing pandemic. Therefore, Estonia fully endorses the European Programme of Work 2020-2025. We applaud the determination of both the Director General and the Regional Director in achieving impact at the country level through WHO's strengthened country presence. We remain committed to working together with the WHO. Thank you.
Thank you very much, Estonia. Next, I give the floor to the delegate of Turkey, to be followed by Romania. Turkey, you have the floor.
Thank you, dear Regional Director, distinguished delegates. Our perception of the European Programme of Work that was put in front of us with one word, which is dynamic. Its core priorities are aligned with our goals. Flagship initiatives seems to be designed to help bridging the gaps in realization of those goals during the process, and restructured office would drive for impact at the country level. I believe that EPW would make our regional office more proactive, as Turkey always supported. As you mentioned in the EPW, People wanted their governments to secure their fundamental rights to better health and well-being as never before. This is not exclusive to our citizens only. Migrant and refugee communities in our countries shelter the same expectations from us as well. With this understanding, Turkey, as the host country of the biggest refugee and migrant population, strives to protect their health security and to provide a supportive environment for them to live in as much as our citizens. During the process, WHO was our biggest technical partner. Therefore, we hope that the new configuration of the regional office bolsters the engagement of the office to respond to health needs of refugees and migrants under the guidance of EPW. Regional Director, these are the times that we have to be creative with our resources. It's also the time to be courageous and learn from our mistakes. Therefore, it's time to come together with the member states to work on a tailored support for national health emergency plans. In order to scale up regional preparedness to pandemics, regional office should also design simulation exercises at region-wide. In this context, I believe that the GDO Istanbul office we opened last week to be an effective instrument in implementation of EPW. Regional Director, in terms of your new resource mobilization strategy, which seems to serve more country impact, Turkey expects transparency. This includes resource mobilization, resource utilization of country offices, as well as conduct of business, such as partnerships and implementation of flagship programs. Distinguished participants, the measures we have taken will shape the health topics of next generation. An agile, proactive, and responsive regional office will help rejuvenation of the WHO Europe. I believe you have prepared a good and ambitious strategic vision for that and to live up to our expectations from you. Thank you very much.
Thank you very much, Turkey. I now give the floor to the delegate from Romania, to be followed by the United Kingdom. Romania, you have the floor.
Your Excellencies, Director General, Regional Director, Honorable Ministers, ladies and gentlemen. I have the honor to speak on behalf of the member states of the Southeastern Europe Health Network who have associated themselves with this statement: Albania, Bulgaria, Bosnia-Herzegovina, the State of Israel, Republic of Moldova, Montenegro, Republic of North Macedonia, Romania, and Republic of Serbia. The COVID-19 pandemic has taught us the hard way 3 key lessons: the importance of solidarity, the need for health system preparedness, and the interdependence between health and the economy. The upcoming years will be crucial to achieve sustainable future in our region and further upgrade public health services and capacities at regional and sub-regional levels. Large-scale transformation in a complex public services environment such as health sector can remain elusive unless leaders are able to think creatively and beyond their immediate organizational roles. With this in mind, I would like to express deep gratitude for Dr. Hans Kluge, WHO Regional Director, for his constant, long-standing commitment and hard work, especially targeting Southeastern Europe region to ensure healthy lives and promote well-being in the region. The WHO regional support through providing the region with the highest possible technical expertise allow the Southeastern Europe Health Network to strengthen its capacities and establish a strong governance and partnership collaboration that kept the 9 member states in a strong alliance with the public health for almost 2 decades. Allow me to highlight several key recent initiatives of the network that were implemented under the Chisinau Pledge on: first, building critical skills on knowledge necessary for health workers to respond rapidly and efficiently to COVID-19. The network conducted an assessment on stress and burnout among healthcare workers during the COVID-19 pandemic. strengthening sexual and reproductive health, implementing colorectal cancer screening programs, reducing childhood malnutrition and obesity, enabling healthy lifestyles choices from early age, improving health literacy, reducing health impact on polluted air through strengthening health system and multi-sector response on the network member countries. The network puts particular value into the strategic partnership with the WHO Regional Office for Europe, especially in the framework of the signed first sub-regional cooperation strategy 2018-2023. This multi-country and cross-organizational platform brought additional to cooperation and learning channels to strive for more solidarity, equity, and results-oriented actions. Significant gains have been accomplished, but further challenges lie ahead. It is the right timing to welcome the European Programme of Work 2020-2025, United Action for a Better Health in Europe, and to express on behalf of the member states of the network our commitment to the core priorities of achieving universal health coverage, better protection for people against health emergencies, and ensuring healthy lives and well-being for all at all ages. Ladies and gentlemen, the member states of the Southeastern Europe Health Network strongly supports the proposed draft resolution on European Programme of Work 2020-2025, United Action for Better Health in Europe, and its underlying principles of leaving no one behind and strengthening health leadership. The network sees its partnership with WHO as a main strategic synergy to boost and provide the best fit-for-purpose expertise to the 9 member states. At the same time, no single country or organization can face these global and regional public health challenges alone. For this reason, establishing and strengthening partnerships will be another key component of our work ahead. Therefore, I call on WHO Regional Office and other present partners to provide further support and invest in the network as a cost-effective vehicle for providing assistance in the regional context. Co-generation of investment in the southeastern region in terms of intelligence and funding is key to achieve long-standing results and sustainable health gains, promoting a culture of health. Thank you for your attention.
Thank you very much, Romania. We will now take a short break for a physical exercise, and we have brought back our physical coach, Johanni, here in the room in Copenhagen to exercise with us. And I was very happy to see how a lot of you around the region were also exercising in your offices in your capital. So please join us in the physical exercise. Johanni, you have the floor.
Thank you very much. I'm glad to be back here. All right, guys, so now 2 points. We're going to do some physical exercise. We're going to do some breathing exercise. You've been here sitting down for over 5-6 hours already. So now this will help you not only increase your blood flow, release some of the tension accumulated for perhaps poor posture or prolonged sitting, right? Increasing the blood flow in those articulations, especially on the neck, shoulders, upper back, and hips areas. So if you can follow me through, if you can place your hands around your hips, and if we start shifting side to side, releasing some of the tension on the hips, lower back, and glute muscles. And that for 5 seconds, 5, 4, 3, 2, 1. Now back to straight position. Now if you can place your arms right in line with your shoulders, now we're folded. From this position, we close, open, and lift. And now we're doing a fast pace, all righty? So we can stimulate those muscles, join, increasing the blood flow and helping us with concentration and span. Let's go, come on, 10 seconds. And 9, 8, 7, 6, 5, 4, 3. We got 2 more, ladies and gentlemen. We got 1 more. And now those arms remains fully extended. And from this position, if we drop the left, the right remains fully extended and shifting to the side. Now, this allows your obliques, love handles, and hip area to release some of the tension. And now, both arms are back up. Now, my right drops, and similar movement on the other side. And shifting, you will see that there's one side that is more stiffer than another. 4, 3, 2, 1. From this position, both arms are up, bring it down, and now allow me to bring my right leg forward and just stretch a little bit, keeping the front one fully extended as the back one is slightly bent, and shifting your glutes back, feeling a little bit release, especially on that sciatic nerve, glutes, hamstrings, quadriceps. 4, 3, 2. Now we switch to the other side, please, and perform the same movement. And let's go. Let's go. Okay, no more sitting in here. Let's go. Come on, push it. Let's go. 5, 4, 3, 2, 1 more. And now, fully extended, right over. And now let's stretch the neck. Neck a little bit here, pulling. If you have a sensitive neck, just be careful pushing down. You bring that shoulder. My left shoulder is pushing down as I bring my neck to the right, having 2-point of pressure. 4, 3, 2. We switch to the other side. And deep inhale, long exhale, properly oxygenating ourselves, providing ourselves with a little bit more oxygen, telling ourselves to relax while we stretch and release some of the tension on those struggle areas. 4, 3, 2. Last but not least, place both arms behind. We arch your back, pushing your neck forward for 5, for 4, for 3, for 2. And now, last but not least, here we go. And shake your arms, shake it, shake it, shake it. Let's go. All right, for those of you who need to type, let's go. Just release the fingers. Come on. Let's go for 5, 4, 3, 2, 1. Place your hand together. Ladies and gentlemen, thank you. All righty.
Thank you very much. That was very energizing. So let's see if the honored delegate from the United Kingdom has caught his breath. United Kingdom, you have the floor.
Thank you very much for the presentation so far for the discussion. We very much
Excuse me, I'm afraid we do not have sound from you, from the United Kingdom. Very, very poorly. It seems to be the microphone at your end. If you could move closer to the microphone, perhaps.
Is that any better?
It's not really better. So we will just move on and then we'll get back to you. So the next speaker is the delegate from Montenegro, to be followed by Lithuania, and then we'll get back to the United Kingdom. Montenegro, you have the floor.
Regional Director, Excellencies, Montenegro expresses full support to the European Programme of Work. As a member of Small Countries Initiative, Montenegro would like to take this opportunity to highlight the importance of small countries in the context of the European Programme of Work. In our fight against COVID-19, small countries have been put to the test, but we did not crumble. Instead, we were able to rise up and do what we had to do in almost feline manner, act quickly, flexibly, with agility, and use our strength as a united network to help each other through these hard times. We are still at it. With COVID-19, we see how interconnected we are and will continue to be. We understand the utmost importance bringing together member states' efforts to put people at the center of services. We have learned to use innovation, go beyond our so-called comfort zones, and capitalize on practice-based information available to us as a network of what works. Most importantly, this health emergency has shown us and continues to reiterate to us the importance of having trust in our health leadership and in partnership among member states. These are core elements in life of small countries, as are core elements of the European program. In this regard, we would like also to mention and encourage the efforts of Central European Initiative under the Montenegrin presidency in providing a coherent and coordinated response to the health emergency in the region. As we believe that regional collaboration in this field is now needed more than ever, we commend and strongly support the establishment of joint Central European and World Health Organization task force. We welcome the joint statement on solidarity and cooperation among the Central European Initiative member states in the face of challenges posed by COVID-19, adopted by the head of governments of the member states at the extraordinary virtual meeting held on 15th of May under the Montenegrin presidency. This document recognizes and reaffirms that cooperation, confidence, and solidarity are the most efficient responses to the pandemic. Dear colleagues, Montenegro remains committed to leaving no one behind, and we recognize this as a core value of the European Programme of Work in our joint efforts to fight against the COVID-19 pandemic, as well as other already existing health challenges. Montenegro welcomes the program work's focus on integration of behavior insights in policy making to help and orient citizens to make healthier but also safer choices. To deliver universal health coverage, Montenegro countries need support in improving financial protection so we can be sure to control out-of-pocket expenses when seeking healthcare. COVID-19 has made it clear that health is everyone's business. And to put this in practice, there need to be governance capacity to advocate and promote health in all policies. Health advocates are needed both inside and outside the health sector, across the governments and in parliaments. The European Programme of Work proposal to invest in strengthening governance capacity across different levels will make sure that health becomes everybody's business. United Action for Better Health in Europe. This is a very fitting title for these times and something that small countries have taken to heart. Being united is in our DNA. No country can do this alone, and small countries are already working this way and will continue to do so. Thank you.
Thank you very much, Montenegro. Next, I give the floor to the delegate from Lithuania, to be followed by the United Kingdom. Lithuania, you have the floor. I think we have some technical issues here in Copenhagen, so we're trying to reboot the system or whatever. Here we go. Lithuania, you have the floor, but we need the sound on.
And its member states. Lithuania welcomes the European Programme of Work for 2020-2025, United Action for Better Health in Europe, to strengthen and unite the work of the regional health authorities. This program outlines the plan of action on how the WHO Regional Office for Europe will support its member states' health authorities now in the difficult years to come after the pandemic. We recognize that due to the many challenges brought forth by the pandemic, it is crucially important to focus on establishing universal health coverage. To do so, we must put member states of our communities at the center of care, ensure that the health services and medicines are affordable and accessible, as well as sustain and support the existing health workforce during the post-pandemic recovery. We especially appreciate and support the focus on mental health and digital health promotion. We applaud the priority to improve the regional and national response against the health emergencies by offering support to ensure preparedness and response capacity to deal with the current issues, as well as to better manage future crises. Ultimately, we recognize the priority to promote health and well-being, highlighting the equally important topics of non-communicable diseases, antimicrobial resistance, and vaccinations, as well as the promotion of healthier behaviors, which remain paramount factors for proper health. Lithuania gives its full support to the program and is looking forward to effective collaboration with the regional office in implementing it. Thank you.
Thank you very much, Lithuania. We will now see if we can re-establish connection with audio with the United Kingdom, to be followed by the Czech Republic. So United Kingdom, you have the floor, please. United Kingdom, I'm so sorry, but we do not have the audio connection. Do you need to unmute at your end? We do not have sound from the UK. I'm so sorry. We will be moving on, and then I'll try and get back to you one more time. So the next speaker, I'll give the floor to the delegate from the Czech Republic, to be followed by Norway. Czech Republic, you have the floor.
Regional Director, distinguished delegates, ladies and gentlemen. The Czech Republic fully aligns itself with the statement delivered on behalf of the EU. More than ever, it is an honor to have this opportunity to address the Regional Committee. The European Programme of Work 2020 till 2025 is a very ambitious strategy that focuses on needs of the European region. Though we doubted the capacity of our health systems to handle COVID-19 pandemics in the beginning, we have realized straight on that the real challenge is to ensure that pandemics does not stop provision of the rest of healthcare services. I believe that finding the right balance between responding to the pandemic and ongoing delivery of healthcare services is the major obstacle we are currently facing. The EPW gives us guidelines for this uneasy task. Personally, I am very glad that the EPW does not omit the accessibility of affordable medicines, as this has been an important topic even before the pandemic that has reminded us how crucial it is to ensure key drugs for our patients. Together, we have to work on finding solutions. We cannot accept restrictions imposed on trade with medicines and other life-saving goods anymore. I very much welcome the Mental Health Coalition as one of the 4 flagship initiatives included in the EPW. In the Czech Republic, we paid attention to the mental health before the pandemic, but we have alternated our activities to respond to the impacts of COVID-19 on mental health. A special working group has been set up to measure COVID-19 impacts on mental health, including children's health. Thanks to the mapping of mental health effects, we will be able to understand the situation and prepare recommendations for further measures. Dear Regional Director, the Czech Republic will work with you with pleasure on the implementation of the European Programme of Work. Thank you for your attention.
Thank you very much. Next, I give the floor to Norway, to be followed by Bulgaria. So Norway, you have the floor.
Thank you, Chair. Norway takes careful note that the proposed European Programme of Work builds on the general Programme of Work adopted by the World Health Assembly 2 years ago. In doing so, it is clear that there is full alignment between the priorities of the organization at global and regional levels. This is an important step towards an organization working effectively across the different levels. We strongly support this approach taken by the Regional Director Kluge as the right way for WHO to work, including when it comes to priority setting. We also support the proposed priorities, including the important work to follow up on the resolution on transparency in medicine markets from the World Health Assembly in 2019. COVID-19 has provided some encouraging signs from the pharmaceutical industry on collaboration for global health. It is important that we continue to build on this and continue to challenge the pharmaceutical industry. In collaboration with the regional office, Norway plans to host a conference next year on the need to renew the social contract between national public health authorities and the pharmaceutical industry in order to secure sustainable solutions in the market for medicines. Thank you.
Thank you, Norway. Next, I give the floor to Bulgaria, and then we try and go back to the United Kingdom. Bulgaria, you have the floor.
Director General, Regional Director, distinguished delegates. Bulgaria aligns itself with the EU statement and in its national capacity supports the WHO European Programme of Work 2020-2025 United Action for Better Health in Europe. The programme adheres to 3 strategic priorities set in GPW 13, thus building a platform for recovery and reform after COVID-19. The pandemic and the economic problems that followed pose a serious threat and put health and social security systems in European countries in a vulnerable position. At the same time, health and social protection are a key element of the economy and society, and reforming this system in times of economic instability requires balancing the need for large investments and ensuring that the listed key priorities are met. This calls for political will, innovative approaches, use of new technologies, more efficient organization of systems and ability to change, which we can see as building blocks of the program. Bulgaria has made significant progress as regards the health of its population. Despite the improvement in the country's overall health status, however, challenges in many areas remain, both with non-communicable and communicable diseases. The global crisis with COVID-19 has seriously affected the entire European region, including our country, and has outlined another area that requires strategic solutions and effective measures. In the context of the global crisis with COVID-19, the introduction and development of e-health and the provision of prompt and authorized access to data necessary for the protection of human health, as well as timely and adequate treatment, is a key importance. The medical data and health information management is critical during the pandemic. The urgent construction of the comprehensive integrated national health information system is one of the major priorities of the Bulgarian Ministry of Health. Our digital transformation policy in the healthcare sector, based on the 3 technology pillars: cloud technologies, development of wireless communication networks, and mass deployment of high-speed optical data networks, is in line with the EPW's flagship initiative towards empowerment for digital health. In the context of global pandemic, Bulgaria, along with other countries in the European region, also faces a number of challenges. From the outset, the Ministry of Health has followed all the WHO guidelines, and the initial tight control has enabled the health system to prepare for a better response. The major issues are related to the shortage of medical staff, the influence of public attitudes from misinformation and fake news, as well as the economic effects highlighted in the EPW. We believe that in the drastically changed circumstances after the global crisis with COVID-19, the search for innovative approaches towards building effective mechanisms to address health challenges at regional, national and local levels is timely and necessary, and we will continue to fulfill our commitments as a reliable partner of the WHO Region Office for the implementation of EPW. Finally, Regional Director, I would like to extend our government's gratitude to the WHO headquarters and the Regional Office for Europe for its continuous guidance, expert and technical support provided during COVID-19 hard times, as well to Member States for their solidarity and cooperation. Thank you.
Thank you very much, Bulgaria. Next, I give the floor to the delegate from the United Kingdom, to be followed by Denmark. United Kingdom, you have the floor.
Thank you, Chair. Can I check? Can you hear me this time?
Yes, excellent. Perfect. You have the floor.
Thank you. Sorry. Thank you very much. So, Chair, Regional Director, we warmly welcome the launch of the European Programme of Work and very much support it. We welcome the 3 core priorities, which link to and build on the triple billion goals of the 13th General Programme of Work. In the light of the current pandemic, these priorities seem more important than ever. As many colleagues have reflected on today, the pandemic continues to highlight not only the importance of reacting promptly to health emergencies when they arise, but also the importance of strong health systems and universal health coverage required to deal with COVID-19 and its effects. We've been made increasingly aware of the importance of health and well-being in dealing with the individual response to the disease, but also the broader health and societal effects of the pandemic. We're pleased to see the European Programmes of Work's particular perspective, which recognises the challenges, opportunities and priorities which we face in our region. The 4 flagship initiatives represent priorities for the UK also, and we particularly welcome them. So on mental well-being, that will become increasingly relevant as we deal with the societal changes of the pandemic. Digital health is championed by our own government. We must make use of all the tools at our disposal to face the challenges ahead and strengthen our systems. And we have many examples of innovation in our own health system, which we'd love to share with others. On healthier behaviours, the current pandemic has highlighted the importance of those behaviours by individuals, but also we're gaining huge behavioural and cultural insights into the decisions at population level and how we can influence those decisions for the good of all of us. And then finally, this links very closely to the European Immunisation Agenda 2030 as we search for a vaccine against COVID-19 and also, of course, face the challenge of controlling other diseases like measles, for example, for which we already have the tools, but where implementation is essential. So in summary, we're really pleased to support this programme of work and we'll work with you to deliver it over the next 5 years. Thank you very much.
Thank you very much. Next, I give the floor to Denmark, to be followed by Spain. Denmark, please.
Dear President, dear delegates, dear Regional Director, we are still in the middle of our fight against COVID-19, and the threat is obviously not over. We see rising numbers of infected people all over the world. This is also the case here in Denmark. And I would like to thank the WHO for the enormous effort in helping and guiding member states during this worldwide crisis. The virus does not know national borders. Cooperation, coordination, and knowledge sharing are important. And this is why we need a strong WHO now more than ever. Dear Regional Director, I would like to thank you and your staff for your amazing work during the past months. Today you present us with this very ambitious and important European Programme of Work. And Denmark strongly supports the programme and the health policy priorities behind it. It aligns with the global general programme of work and it takes into account the COVID-19 crisis. It gives priority to protecting people against health emergencies and it points towards the task of ensuring recovery after the crisis. The pandemic has underlined how deeply a health crisis affects us, not only physically, but also mentally. Therefore, we are pleased to see mental health having such a central role in the programme. In June, Denmark initiated the development of a 10-year mental health plan. The plan will address the important issues of inequalities among people with mental health disorders. We must not take good mental health for granted. It is a vital element of living. And finally, prioritizing mental health is an important step towards achieving universal health coverage. Thank you.
Thank you very much, Denmark. Next, I give the floor to Spain, to be followed by Slovakia. Spain, please.
Dear President, dear Regional Director, dear delegates and colleagues, Spain aligns with the European Union and its member state statement. My country supports also the resolution. We want to thank Dr. Klug and the Regional Office for the hard work and emphasis on driving his vision of united action for better health in Europe under such a difficult situation. COVID-19 pandemic has changed the beginning of this new mandate. However, the Regional Office has the challenge of contributing to the fight against COVID-19 and giving added value to our region. We are still focused in a joint fight against COVID-19. Nevertheless, the 13th Global Working Programme should still be a pillar in our daily task. Spain appreciates the core priorities in the European Programme of Work 2025. Besides, we support the 4 flagships which are in alignment with the Spanish health agenda priorities. My country is fully engaged in the Agenda 2030 objectives. EPWU core priorities, universal health coverage, protection against health emergencies, and protection of the health and well-being of people throughout their life are the way to achieve SDG 30. Spain says that citizens expect from their health authorities to work and be accountable for those objectives. Spain fully supports the vision of the EPWU about the determination to leave no one behind and reinforce the leadership capabilities of health authorities. Those aspects are very important when focusing on the recovery, resilience and robustness of health system and public health services in COVID-19 pandemic wake. Dr. Klug, my country, Spain, appreciates the close collaboration and support of the Regional Office for Europe in this important crisis. We offer to continue our collaboration in the regional initiative promoted under your mandate. Thank you, sir.
Thank you, Spain. Next, I give the floor to Slovakia, to be followed by Andorra. Slovakia, you have the floor.
Honorable Chair, distinguished Director General, distinguished Regional Director, ladies and gentlemen. Slovakia aligns itself with the statement of the EU and supports the resolution under agenda item. Slovakia highly values the efforts to align the work of the European region with the global action and strategic priorities outlined in the 13th General Programme of Work. Slovakia also appreciates that the European Programme of Work strives to maximize country impact and its focus on health and socio-economic inequities. Slovakia perceives a need for an adequate response to health emergencies in these highly exposed times and welcomes the launch of the WHO impartial, independent and comprehensive evaluation. Furthermore, Slovakia underscores the WHO mandated leading and its normative role in the global health. Likewise, Slovakia acknowledges that well-balanced WHO outreach requires an internal relations optimization so that the results become tangible and at the regional level. Alongside, the coronavirus pandemic has demonstrated insufficient capacity to detect, prevent and respond to challenging events, which is why a concise focus on global health security structures will be pivotal. Lastly, in the view of the coronavirus burden, Slovakia remains firm in fostering regional level priorities, including patient safety, preventive strategies, long-term care, mental health, and the health information systems. Guided by the principle of global solidarity, Slovakia deems crucial the equitable access to diagnostics, therapeutics, vaccines and preventive evidence-based programs. Thank you.
Thank you very much, Slovakia. Let me just note that it's now 4 o'clock Central European time, according to the published program. We were supposed to end at 4 o'clock, but we still do have more speakers on the lists, and I expect that we will probably continue working for another hour this afternoon. So if you have the patience, please stay with us for another hour, and I would expect that we could wrap up today's agenda around 5 o'clock Central European time. So next on the list is the delegate from Andorra, to be followed by Sweden. Andorra, you have the floor. So Andorra, we do not have sound from you. Can you please check your microphone if it's unmuted or bring it closer? Thank you. Please go ahead, Andorra, and see if we can get sound. So I'm sorry, Andorra, we do not have sound, so I'll move on to the next delegate and then we'll come back to you. So next on the list is Sweden, to be followed by Switzerland. Sweden, you have the floor.
Thank you very much, Mr. President and Regional Director. Sweden aligns itself with a statement made on behalf of the European Union and its member states. We commend the Secretariat for their hard work in finalizing the European programme work in time for the adoption by the Regional Committee. The EPW will steer the strategic direction of the region for coming 5 years. We appreciate that it is in line with the WHO General Programme of Work and that different levels of the organization will work together to achieve common goals. I would highlight 5 priorities that we consider particularly important. First, the EPW acknowledges the importance of gender equal health, and we welcome the commitment to gender mainstreaming in the work of the organization. Second, we welcome the focus on moving towards universal health coverage. Health services, both preventive and curative, should be made available based on the principle of everyone's rights to health. Access should not be defined by ability to pay, but to need. It will be particularly important to ensure and enhance financial protection in the wake of the COVID-19 crisis. However, the pandemic has shown once again that governments cannot only focus on reducing out-of-pocket payments and addressing gaps in health coverage. Social protection, such as paid sick leave or benefits enabling parents to stay at home if their child is ill, are fundamental. Third, the EPW commitment to upholding sexual and reproductive health and rights is a sign of strength in times when already agreed commitments on human rights, especially SRHR, are being increasingly questioned. Sexual and reproductive health and rights strongly affects people's health and well-being. We appreciate the attention paid to SRHR in health promotion, as well as in moving towards UHC, but would like to highlight the need for SRHR in health emergencies too. Fourth, the pandemic has had vast secondary effects on mental well-being. We welcome the priority this issue is given in the EPW and the flagship initiative, the Mental Health Coalition. Last, the pandemic has shown the serious consequences an infection can have in the absence of effective treatment. The fight against AMR must continue and be given even more priority. Sweden is a strong supporter of the One Health approach. We are looking forward to taking part in the coming program budget for the EPW. Robust funding of SRHR and AMR must be given the priority it needs. Thank you, Chair.
Thank you very much, Sweden. Next, I give the floor to the delegate from Switzerland, to be followed by Andorra. Switzerland, you have the floor.
Monsieur le directeur régional, la Suisse félicite toute l'équipe de l'OMS Europe pour le programme de travail européen 2020. La large concertation qu'elle a organisée pour son élaboration. Bien que nous reconnaissions que des adaptations sont nécessaires, la pandémie actuelle confirme l'importance de trois piliers fondamentaux: l'octroi d'un accès universel aux soins et à la santé publique, la riposte rapide et adéquate aux situations d'urgence et la garantie d'une vie en bonne santé et d'un bien-être. Protéger la santé de tous est une responsabilité conjointe. Nous devons nous engager ensemble pour en garantir l'impartialité. Pour ce faire, la Suisse a lancé sous l'égide de son ministre de la Santé une coalition pour une architecture universelle de protection sanitaire aux côtés du Botswana, du Népal et d'Oman. Nous espérons contribuer ainsi aux réflexions à venir pour un renforcement de l'OMS. Le bureau régional de l'OMS pour l'Europe doit contribuer en bonne intelligence à la concrétisation du projet mondial défini par le 13e programme général de travail de l'OMS, complémentant les activités au niveau global et national. En vue d'un probable report à 2025 de l'objectif des 3 milliards au niveau global, les conditions sont, à notre avis, remplies pour un alignement du programme de travail européen et du programme de travail global au cycle programmatique onusien. Pour ce faire, les futurs programmes de travail devraient être d'une durée de 4 ans. En ce qui concerne l'accès à des produits pharmaceutiques abordables qui répondent aux besoins, une approche holistique est nécessaire, évaluant toute la chaîne d'approvisionnement, comprenant la réglementation, le cadre pour la recherche et le développement, la production, les procédures d'achat et de distribution. La recherche, le développement et surtout la distribution équitable d'un vaccin sûr et efficace contre la COVID-19 est vitale pour la santé de nos populations et de nos sociétés. La Suisse s'y engage avec force, notamment en contribuant à l'établissement d'un mécanisme global pour un accès rapide pour tous, à savoir la COVAX Facility. Je vous remercie.
Thank you very much, Switzerland. And I'll give the floor to the delegate from Andorra, to be followed by Italy. Andorra, you have the floor.
General Director, Regional Director, Excellencies, ladies and gentlemen. First of all, I would like to thank you for this opportunity to speak to all of you on behalf of the Principality of Andorra. Dr. Tedros and Dr. Klug, thanks for your inspiring words this morning. Secondary, Andorra wishes to make
excuse me, Andorra, I'm sorry, but the sound is very bad, and I'm not sure that we can provide interpretation with this sound. So can you move the microphone closer, or should we try coming back to you? You want to try again? Okay, so we'll just move on, and then it will come back to you once more, but the sound is so bad, so we cannot hear and provide translation. So next I give the floor to Italy, to be followed by Monaco. Italy, you have the floor.
Thank you, Chair. Honorable Ministers, dear Regional Director and colleagues, Italy aligns itself to the statement made by Germany on behalf of the European Union and its member states. Italy supports the proposal of EPW for 2020-2025 and consider it a necessary and positive signal of our will of going forward, overcoming the COVID pandemic. We appreciated the structure of the draft program and the efforts for contributing to reach the core priorities of triple billion targets at global level. We appreciated particularly the emphasis on the role of health in the society and the focus on health leadership. We noted also the flagship initiatives proposed and the provisions of a system for measuring the progress of the program. Anyway, we invite to implement the program in next years, paying particular attention to the most vulnerable groups, including migrants, and working for the reduction of geographical variability in health conditions. Moreover, we consider essential The plan can contribute to improve the number and quality of services at community level, in particular of the digital services. Finally, we consider that further efforts should be aimed at coordinating any work with topics discussed in other international fora, like value-based care and patient safety. Thank you.
Thank you very much, Italy. Next, I give the floor to Monaco, to be followed by Andorra. Monaco, you have the floor.
Oui. Je vous remercie, Monsieur le Président, et j'espère que vous m'entendez correctement. La principauté de Monaco a pris connaissance avec beaucoup d'intérêt du nouveau plan de travail et dont de nombreux axes sont une priorité également pour Monaco. Au travers de cette intervention, je souhaitais remercier le Dr Klug et son équipe pour le travail ayant conduit à l'élaboration de ce plan dans le contexte de la Covid-19, mais aussi remercier tout particulièrement le Dr Klug une fois de plus pour avoir déjà mis en œuvre un de ces piliers tel qu'énoncé dans le plan, à savoir être à l'écoute des États membres, de leurs spécificités, afin de leur apporter très rapidement des solutions. Merci Hans pour tout cela et nous espérons que nous pourrons poursuivre, en particulier dans le cadre de nos discussions bilatérales et la prise en compte des spécificités des petits États. La principauté soutient pleinement l'adoption de ce plan. Je vous remercie.
Thank you, Monaco. And I'll give the floor to Andorra, to be followed by Bosnia and Herzegovina.
General Director of WHO, Regional Director, Excellencies, ladies and gentlemen. I hope you can hear me now. First of all, I would like to thank you for this opportunity to speak to all of you on behalf of the Principality of Andorra. Dr. Tedros and Dr. Klug, thanks for your inspiring words this morning. Secondary, Andorra wishes to make the following statement. COVID-19 has seriously affected us, as well as many other countries in the world, and all small countries in the WHO European region. However, our indicators seems much more worse than our figures in absolute values, which lead us, once again, to the need that the statistics of small countries should not be read in the same way as those of larger states. Even though countries with no cases reported are suffering severe consequences at social and economic levels. Like other small states, Andorra is heavily dependent on tourism and trade, and the closure has had catastrophic economic consequences. However, Andorra has made a huge economic effort to alleviate the negative effects on family economies with the aim of leaving no one behind. Andorra, like other countries, is preparing to tackle a future second wave of the pandemic. From today, the whole education system is working, and following WHO guidelines, the motto in schools is distance, hands, facial mask. In addition, an extremely high percentage of school children and teachers have been tested for a PCR on voluntary basis, making us the first country in the world to carry out PCR screening tests in relation to the number of inhabitants. Andorra would like to thank the WHO for all the work that has done to help us raising awareness among our population, for all the information it has shared, and for its guidelines and recommendations. Andorra strongly agrees with the words of Dr. Tedros. No one will be safe until we are all safe. In this line, with this idea, Andorra has committed itself to participating in multilateral projects and initiatives, with the aim of ensuring equitable access to vaccines against COVID-19, such as COVAX, and the means of diagnosis and treatment of the disease, such as ACTA. Andorra also participates in initiatives which aim to reinforce the leadership of the WHO in the objective of achieving a healthier and equitable world for all. We are convinced that the European Programme of Work 2025 is a magnificent instrument for facing the challenges that the health system had before the COVID-19. but above all, for continuing on that path while we face the pandemic. Andorra, therefore, gives its full support to the EPW and encourages other states to do the same. Last but not least, Andorra, which has already announced its support to multilateral and cooperative initiatives and actions, has, such as Small Countries Initiative, wishes to share with the rest of the countries the motto that appears on its coat of arms, Virtus Unita Fortior, which is a Latin phrase that has guided us for more than 750 years. And we can translate it as united we are stronger. That matches perfectly with united action for better health in Europe. Thank you very much for your attention.
Thank you, Andorra. Next, I give the floor to the delegate from Bosnia and Herzegovina, to be followed by the Netherlands. Bosnia and Herzegovina, you have the floor, but we do not have the sound from you. Can you switch on the microphone, please?
Your Excellencies, Honorable Director General, Mr. Tedros, Mr. Regional Director, Mr. Kluge, ladies and gentlemen, we thank the Regional Director and WHO Incident Management Team, the country office led by Viktor Olozhevsky, and the team for fighting the spread of virus with us, for being with us all through the process, providing missions, supplies, and guidance. We thank also EU and ACDC for working with WHO and with us. This is a great opportunity to accelerate even further the whole WHO European region alignment in the spirit of APV to leave no one behind. BIH is standing for and with WHO with its strengthened APV. We believe that our experience and knowledge in organization and delivery of community-based mental health services in Bosnia and Herzegovina, which we have shared at sub-regional level through the Southeast European Health Network, may significantly contribute to the functioning and success of the new high-profile mental health coalition envisaged with the APV. In regards, the whole very much like the emphasize, we would like to very much to emphasize that Federation of BIH support of regional director in planned actions. The country will spread ahead the implementation of APV, which is fully in the line with the vision of Federation of Bosnia and Herzegovina and Bosnia and Herzegovina for the health of people. Thank you very much.
Thank you very much. I now give the floor to the delegate from the Netherlands. The Netherlands, you have the floor.
Thank you, dear President, Director General, Regional Director, and colleagues. The Netherlands aligns itself with the statement delivered by Germany on behalf of the EU and its member states. We thank you and all your colleagues at the Regional Office for your dedication and effort in tackling the current health challenges. Implementing and strengthening the international health regulations is crucial for effective long-term preparedness and response. The Netherlands supports the Regional Office to help countries strengthen national and regional COVID-19 preparedness to international health regulations. As the chair of the Global Health Security Agenda, the Netherlands promotes worldwide implementation of the international health regulations. We believe in a One Health approach, as human, animal, and environmental health are complexly linked. Meanwhile, we need to ensure that essential services and activities continue. In particular, AMR, mental health, aging and dementia, and sexual and reproductive health and rights. And we see these priorities reflected in the European Programme of Work. We would like to ask specific attention for the devastating toll of the tobacco epidemic, killing more than 8 million people each year. The Netherlands is very committed to fight the tobacco epidemic, both at national and international level. Our ambition is a tobacco-free generation, and the 9th FCTC conference of the parties is planned to be held in The Hague in November 2021. We hope to welcome you all in The Hague to take the next step into the fight against tobacco. The Netherlands remains fully committed to tackle present and future health challenges together. Thank you all.
Thank you very much, Netherlands. I have no further member states on the list requesting to speak, but before I close the list of speakers from member states, may I ask if there are any other delegates wishing to take the floor on agenda item 4? That does not seem to be the case. I will then move on to the request from UN agencies, intergovernmental organizations, and other observers to speak. And we have received 3 requests to take the floor. And first, I give the floor to the United Nations Children's Fund, UNICEF. Ms. Afshan Khan, you have the floor.
Thank you very much. Dear President, honorable ministers, distinguished colleagues, I'm pleased to join you today to share a few words in solidarity with the clear and topical areas of work identified in the draft European Programme of Work, EPW, covering the period 2020-2025. This is an important plan for all the agencies of the UN system working towards the SDGs, and particularly for the health and well-being of the region's citizens, especially children and young people. It's impossible to ignore the current COVID-19 pandemic, the toll it has taken on individual lives, families, and livelihoods. At the same time, it is also possible that years of health gains might be lost in the wake of the ferocity of the ongoing pandemic. All countries, all systems, especially health systems, are being stress tested to their functional limits, and in some instances, glaring limitations. The investment in prevention and preparedness is key. The draft EPW lays out a clear set of priority areas, consistent with those already highlighted in UNICEF's current strategic plan and regional priorities. We gladly welcome opportunities to work collaboratively, consistent with our mandate and the identified needs across the region. For example, we look forward to advancing our collaboration with the European Commission and WHO on social protection schemes and inclusive social policy, with the aim towards universal access and affordable quality health services. With WHO and UNFPA, we're collaborating on mental health, particularly in the area of adolescent mental health, including SRHR. On digital health, we are working with WHO to expand the reach of health services through new technologies. Health emergencies and medical supplies are additional areas UN agencies are collaborating with WHO. And lastly, in the area of immunization, UNICEF is working with WHO and other partners, such as the European Commission, to address challenges such as vaccine hesitancy and misinformation, as well as the procurement and distribution of vaccines, including through the newly proposed COVAX facilities. United Nations agencies can further leverage existing cooperation by delineating clear areas of responsibility as we work in shared cooperation in areas such as education, gender, social protection, environment and climate, refugees and migrants, and youth. We need to capitalize on the lessons learned through COVID-19 and in earlier years, and strengthen our support to deal with the root causes of diseases, reduce vulnerabilities, and ensure no one is left behind. and strengthen our work in countries. We'd like to thank the Regional Director Hans Klug for his support in including us in the EPW process. In closing, I reiterate our support during these challenging times and beyond, and look forward to productive and collaborative support with the countries of the region. Thank you.
Thank you very much, UNICEF. Next, I give the floor to the Turkic Council, Mr. Baghdad Amreyev. You have the floor.
Thank you very much. Dear President, Director General, Regional Director, Honorable Ministers, and distinguished delegates, I would like to express my gratitude to the Regional Director of WHO, Dr. Hans-Henrik Kluge, for inviting the Turkic Council to the 70th session of the World Health Organization Regional Committee for Europe. Our organization, being a comprehensive regional cooperation mechanism of our member states, Azerbaijan, Kazakhstan, Kyrgyzstan, Turkey, Uzbekistan, as well as the observer state of Hungary, attends at this committee meeting for the first time. Since the beginning of the crisis, as a Turkic Council, we are showing utmost efforts to contribute to the fight against COVID-19 and mitigate the negative effects of the pandemic. We held the extraordinary video summit of the Turkic Council on the COVID-19 pandemic at the level of heads of states. Actually, it was the first video summit in the modern history and first summit dedicated to the pandemic since the beginning of the COVID-19. And we held also a meeting of ministers of health of our member states. As a result of those meetings, we have established a permanent body health coordinating committee headed by the deputy ministers of our member states responsible for coordinating all health cooperation areas. Within this committee, we also established a supply chain group for providing medical equipment to our member states, and also established a health scientific group consisting of leading scientists, specialists, and experts for exchanging experience among medical professionals and establishing cooperation in the development of vaccines and other medicines. Subsequently, in the framework of the health scientific group, and we held face-to-face vaccine workshop in Turkey in August in Izmir. Dear participants, as you can realize, we are in close contact with the World Health Organization since the outbreak of the pandemic. Director General Dr. Ghebreyesus participated in our extraordinary summit, and Regional Director Dr. Kluge similarly participated in our health ministers meeting. We strongly support the proposal of WHO European Regional Office to unite efforts of regional multilateral institutions and mechanisms around health as one of the key objectives of the European Programme of Work 2025, United Action for Better Health in Europe. Last Friday, I have signed with Dr. Hans-Henrik Kluge a memorandum of understanding on cooperation with WHO, which establishes legal basis for our future cooperation, and we will develop together concrete projects in related spheres of health, as well as for the implementation of the European Programme of Work. As a Turkic Council, we are ready to coordinate and support all the efforts, not only in the fight against COVID-19 pandemic, but also in the post-pandemic period in the other areas of the health sector. I believe we will leave these challenging days behind by establishing solid cooperation and solidarity among all participants. Thank you very much. I wish you success in your deliberations.
Thank you very much. Next, I give the floor to the Northern Dimension Partnership in Public Health and Social Well-being. Ms. Ulakari Nurm, you have the floor.
Thank you, Chair.
Dear Mr. President, dear Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. The Northern Dimension Partnership in Public Health and Social Wellbeing welcomes the proposal for the United Action for Better Health in Europe. We are proud to see our partnership among the actors mentioned in this important document. At the moment, our network is in the process of developing our new strategy for the next 5 years, and I can assure you that our future priorities are very much aligned with the European Programme of Work. We will contribute to the programme, and we are ready to continue and strengthen our cooperation with the WHO to achieve our common goals. In addition to the traditional topics that our expert groups have already been addressing for a long time, namely antimicrobial resistance, harmful use of alcohol, tobacco and substance, HIV, tuberculosis and associated infections, non-communicable diseases, occupational safety and health, primary health care and prison health. In the coming years, our partnership will also devote its work to healthy and active aging, integrated care, mental well-being and digitalization, which are all central to the comprehensive EPW and which have become increasingly important due to the COVID-19 pandemic. We also welcome the determination to depart from the continuation of business as usual and aiming for agile implementation and speeding up delivery of results, which is something that our partnership will strive to achieve as well. Dear Regional Director, Dr. Kluge, we would like to assure that the NDPHS is fully committed to support the WHO in making progress in health and social well-being in the region. With this, I would like to thank you for your attention and wishing you all good health. Thank you, Chair.
Thank you very much. This completes the list of speakers and interventions on this agenda item 4 on the European Programme of Work. In addition, a number of written and video statements have been received on this agenda item 4, and the following non-state actors have submitted statements: the Association for Medical Education, the European Forum of National Nursing and Midwifery Associations, the Associations of Dietitians, the International Agency for the Prevention of Blindness, the International Hospital Federation in conjunction with the International Society for Quality in Healthcare, from the World Federation of Occupational Therapists, from the International Union for Health Promotion and Education, the International Diabetes Federation European Region, the European Society for Medical Oncology, the International Federation of Medical Students Associations, the International Pharmaceutical Students Federation, the European Public Health Association, the European Respiratory Society, the International Association for Hospice and Palliative Care, the European Cancer Organization, the Worldwide Hospice Palliative Care Alliance, Movendi, EuroHealthNet, and the European Public Health Association. All these written and video statements will be made available on the RC70 meeting website, and I urge you all to visit the website and review and acquaint yourself with these statements. So this then completes our discussions on agenda item 4, as there have been a number of comments made and also specific questions raised in the interventions. I will now ask our regional director if he wishes to take the floor. Dr. Hans, you have the floor, please.
Thank you very much, Mr. Executive President. And I think it's a good tradition that we structure our work and interventions along the core priorities of the GPW, draft EPW, and now the 4 flagships. But overarching, I noted a lot of appreciation and support that the EPW, the draft EPW, is aligned with the GPW 13 for One WHO, which also comes back to a point made by the intervention by Germany on behalf of the EU on the monitoring and evaluation. And I would like to draw your attention that we are fully supportive of following up on this point. And in fact, paragraph 34 of the EPW has in particularly that at the regional and sub-regional levels, the regional office will develop a range of instruments and platforms, including relevant matrix. Once that the EPW is adopted, we will work on a framework of KPIs, key performance indicators, and of course put this forward to, first and foremost, the Standing Committee of the Region Committee, and then involve all the 53 member states. Already, I would like to reassure you, we're in very close contact with the WHO Assistant Director General, Dr. Samira Asma in headquarters. In fact, 3 countries in our region have pioneered the 3 billion framework already, Turkey, Montenegro and Russia, and thank you for this. And now Ukraine is going a little bit more in depth. Then, according to the core priorities, the first one on responding to and preparing for emergencies, we heard indeed the concern about the infodemic and skepticism towards science. We are very concerned about this, especially with seeing spikes and increases across the region. And that's why we believe that the work around the behavioral insights is so important. In fact, already in 27 countries, the behavioral science tool was implemented, and now this is being put together to provide concrete, pragmatic policy recommendations. Then we all know that our region was a frontrunner, is a frontrunner in progress towards the NCDs, non-communicable diseases. But of course, I was mentioning this morning, this is a big setback, the COVID. So we see investment in NCD prevention and treatment as a foundation for security and future pandemic preparedness. Second core priority is on the universal health coverage. Like during the first round of interventions, we heard very clearly the call to work on implementing the resolution of the WHO on transparency, hand in hand with WHO headquarters, and we're working very closely with the ADG, Marie-Angela, and you heard from Norway that the high-level conference will happen in March 2021 on access to affordable, innovative medicines. Dual-track health system response, that's one of the main points I take away today, that we will have to scale up our work on the dual-track health system response, because COVID will be with us for quite a while, but we can no longer, we don't wait, we have been doing this, but we have to accelerate on the non-COVID health and disease events. Then I recognize that there is a vast majority of the member states agreeing to the reference to sexual reproductive health and rights in the EPW document, which is true and acknowledges was extended in line with the WHO Europe 2016 Action Plan on sexual reproductive health. But I also acknowledge, and I want to reassure this, that I heard that concerns were raised by a few countries on the language related to sexual reproductive health and rights, which we took note and we will reflect in the official report of the Region Committee 70. And I also would like to express appreciation to those countries with who we have been communicating very, very actively the whole weekend. The third pillar is on promoting health and well-being. People-centeredness, people-centered health policy came back time and again. And of course, we know that this first and foremost goes through the primary healthcare and the public health. AMR and One Health, I would like to reassure you that we're also ready to scale up our efforts there with the member states. Several of you are champions, and we count on your support. Health in all policies. One point made, I believe, in the intervention of the EU was the link between health and social services, and that this goes sometimes or often beyond the remit of the health sector. And that's why there was a reference that there need to be a clear legal framework. And I acknowledge this. In fact, I would like to thank in particularly Finland. Finland had this very detailed in the comments to the draft EPW. And thank you very much, Ms. Uti, and your colleagues for that one. So we're taking this into account. It also comes back to, I believe, a comment from Dr. Clemens Auer on, it was termed a steering mechanism for the health in all policy approach, which has to be practical. And I cannot agree more, because there has been many steering committees on health in all policy, but which are more functioning on the paper than in reality. So this needs a good thinking, and we can link this with the Monti Commission, which has a majority of non-health people who are ready to help us how to make convincingly the case that health is not part of the problem, but part of the solution for other sectors. Further on promoting health and well-being, on the NCDs, non-communicable diseases, investing in prevention and treatment. And there again, I would like to express my very sincere appreciation to Dr. Michael Albertovich Murashko for inviting me next week to Moscow to also brainstorm in particular on this issue, and for the very, very strong support through the GDO on NCDs in Moscow, which is so crucial. Then on the flagship that we heard most frequently in the intervention was on mental health. And in fact, this was designed even before the COVID-19. In fact, all the 4 flagships I heard have been tested somehow by the COVID-19 response and testified that these were the right choices, not at least the mental health. And thank you for the support you saw also from the video of Queen Mathilde, that we are very, very committed. Second, digital health and innovation, absolutely. Overall, e-prescription systems have become an essential person-centered tool to improve the performance of the whole health system and also foster the integration between health and welfare sector. Immunization 2030 came back by many member states and also UNICEF, and again I would like to thank Afshan. So tackling the vaccine hesitancy. The concern there is that if there is vaccine hesitancy to a COVID vaccine, that we know from experience it spills over to other routine child immunization. So this is a very, very serious issue. But we have very good practices in many of your countries to tackle this, to assure the vaccine supply. Many of you told vaccine is a global public good, shouldn't depend on low, middle or high income country, and to close the immunity gaps. Fourth, the behavioral and cultural insights. It comes back to informing policy by listening to the citizens. Sometimes we ask what is people-centeredness. It's easy if you are so busy to forget the basic skill of listening. Whether it is in our populations or in the family or everywhere, good listening, not finger pointing, what is the concern? And then to design targeted interventions to specific segments of the population using so-called champions in those communities. Then a final note. I think that you also, through the interventions, approved of the sub-regional approaches that we suggest in the EPW. First and foremost, the Small Countries Initiative. And I'm very, very, very impressed and touched by the San Marino, to the Minister. Thank you so much. You have been the Dean of the Small Country Initiatives, and for your commitment, official expression of continued support. I believe it was Deputy Prime Minister of Malta during one of our meetings who told, small can be great because you are agile, and agility is the core of the how in the EPW. So well done. Southeastern European Health Network, absolutely. Thank you, Romania Presidency, for putting this forward. And also the Central European Initiative. And thank you so much to the different partners that we heard. So I am encouraged by the shared comments of all of you when you say that you need a strong WHO more than ever, and that this requires the ambitious vision we agreed upon today. Ultimately, your acceptance of the EPW is the sign of trust we have been looking for when we talk about solidarity, and we stand by our commitments to deliver on this agenda for all of our people in our beautiful region. Thank you.
Thank you very much, Regional Director. As mentioned by the Regional Director, all the statements made by members of this Regional Committee on this agenda item have been stated for the record and will be reflected in the meeting report of this session of the Regional Committee. Specifically, the reservations on the mentioning of sexual and reproductive health and rights have been noted by Poland, Hungary, and the Russian Federation, and will also be reflected in the meeting report. We can now consider the adoption of the proposed draft resolution on the EPW. This is contained in document EUR/RC70/confdoc/5 revision 4, the European Programme of Work 2020 to 2025, United Action for Better Health in Europe. Is the committee at this time willing to adopt the proposed draft resolution by consensus? I see no objection. The resolution is therefore adopted. Congratulations. I think congratulations to all of us. Congratulations to to our region. Congratulations to the regional office and the secretariat, and very warm congratulations to you, Hans. I think this provides you and the office with a very strong framework and mandate for the work ahead of us. So thank you very much for that. With this, we close agenda item 4, and we have indeed now also concluded our work for today. We have finished agenda items 1, 2, and 4. We will reconvene again tomorrow morning at 9 o'clock Central European Time, and we will resume with agenda item 7. And please let me remind you that we are starting tomorrow morning at 9 o'clock with a private session on elections and nominations starting at 9 o'clock. So for this private session, only representatives of member states or their alternates or their advisors are able to attend, as well as essential members of the Secretariat who are also allowed to attend. Other delegates and observers who will attend the public session starting at 10 a.m. Central European Time are kindly invited to connect in good time to the Zoom platform. So you can actually connect before 10 a.m. for the public session, and you will then remain in a virtual waiting room inside Zoom until the Secretariat opens the meeting for the public session. You will all need to follow the same onboarding procedures as you used this morning. And finally, and on behalf of the President, Dr. Tsoi, of this regional committee, and on behalf of myself, I would also like to thank all of you for very orderly and active participation in the meeting today. I also thank all the technical staff here in Copenhagen, as well as the Secretariat, and specifically I thank all the interpreters for their support and for providing excellent translations for us here today. I wish you all a lovely evening and see you tomorrow morning, and the meeting is now adjourned.